This is really an extraordinary event because we're celebrating someone who is from where we're from, who's done so much amazing work in so many countries around the world. And we look at a world today that seems like it's descending into madness and chaos. And it's not hard to feel despair. It's not hard to decide to tune the world out. But what you have to hear in these moments are the moments of hope. That on the ground all over the world there are seeds blooming. And there was a great poet, and I wish I knew the poet's name, but I'm really bad at stuff like that, but I got the quote from Stephen Lewis, who said this at Jack Layton's funeral, that there's a new world being born, and if you listen really close, you can hear her breathing. And that's what we need to keep in mind. And I think when I see the work that Gretchen Roedde has done around the world, she's been there for the birthing of this new world. The little bits of change that have brought phenomenal transformation in the lives of people from Uganda to New Guinea to Laos, around the world. It's very important. So we are very blessed tonight to have Gretchen here. Dave Patterson. Do I want to turn it over to a real international hero, Dr. Gretchen Roedde. Thank you.
To thank Charlie for example. This book was published in various excerpts in High Grader magazine, which Chuck and Britt edited back in the day. So it wouldn't have come to be a book if it hadn't had earlier exposure. And also Charlie was part of the all-party support for global maternal health in the G820 summit. So in order to improve maternal health in the third world, we have to have everybody working together. We have to have all political parties working together. We have to have all churches working together, all non-governmental organizations together. And as a community around the world, we can help to bring about change. This book is already bringing about change. So a week before it was published, it was already on the bestseller list, #6 Canadian nonfiction in the Globe and Mail. Small group, which turned into another group, which turned into another group, and then there was 400 women from across Canada who were United Church Women, and they were raising money for a project in Tanzania in maternal health. So I would read the moving story about delivering the baby in the pickup truck and being in the village, the Maasai village, and everybody would be all moved, and then they'd buy the book. And together we have raised $178,000, and I'm sure it's more now, for that project with the United States. There's all kinds of stuff. And so you're going to see that this book is not only going to make you understand more about what's going on, but you're also going to be part of the change of making it better. People ask me, why did I write this book? And the poem is by Pablo Neruda. And this is the answer to why I wrote this book. Give me for my life all lives. Give me all of the suffering of the whole world. I am going to turn it into hope. Give me all of the joys, even the most secret, because otherwise how will these things be known? I have to tell them. Give me the labors of every day, for that's what I sing. The first time I went overseas, I went to Uganda, and the war was just ending. It was 1987, and I was absolutely terrified, and I was also quite overwhelmed. And this is a country where Charlie's daughter is now in Uganda, just to show that madness is kind of infectious. And she's responsible in doing some work in the Karamoja, which is the poorest part of Uganda, where the death rates of pregnant women and children under 5 are the highest in the country, and the poverty is the greatest. I had never seen such suffering. I had never fully understood that the photographs and newscasts of famine and HIV victims were of such terribly real human beings. In the first hospital, on our first day, I had to struggle with nausea and keep my face tight with control, since I felt I was shattering into small pieces. I glanced at my companions, who seemed unmoved or perfectly able to cope, and I became painfully aware of my inexperience. How could one possibly get used to this? In the crowded outpatient department, patients in ragged clothing spilled in from the veranda, and naked children and babies cried. Mothers seemed listless and resigned. The smell of urine permeated the room. Nurses used the same needle to inject many different people, wiping the needle on their worn dresses between patients. One named Beatrice asked me plaintively, "What else can we do? We know how bad things are here. We know we are spreading infection. But there are no supplies, and even the water we use is not clean." These hospitals in the center of the AIDS epidemic had no gloves for health workers, no condoms, and few needles. We shuddered remembering the well-stocked warehouses we had left behind days earlier in the capital, where our fellow jet-set development health personnel were busy joining one another at the Entebbe Sailing Club on Lake Victoria for drinks and sailing, making dates for tennis, and hiring better cooks and houseboys. In a hospital on the border with Zaire, on the pediatric ward, we saw 3 small children who were so pale they appeared to be white, not black. They were severely anemic, suffering from malaria, and in desperate need of blood transfusions. The families were being shouted at by the nurses, who were demanding money that the families didn't have. 2 children were turned away. One small girl, Flavia, appeared to be about 4 years old, and was a little better dressed than the 2 left to die. Since there was no blood bank, once her mother was able to get enough paper Uganda shillings from the other members of the family to pay for treatment, the mother herself was strapped up to donate blood. This direct transfusion from mother to child was done without her being tested for HIV.